Today, we're going to talk about the top 6 signs that you're suffering from a pelvic floor or core strength problem that can be easily fixed with physical therapy. Hi, my name is Dr. Aaron LeBauer from LeBauer Physical Therapy here in Greensboro, North Carolina. And in this video, what I'm going to do is I'm going to share with you the top 6 signs that you're needlessly suffering from a common but not normal pelvic floor problem or a core strength issue. They can be fixed with physical therapy visits. Before we get into the video, please like the video or hit subscribe and hit the notification bell, because what I'd love you to be able to do is be notified when we put out other videos just like this. I'm a physical therapist, massage therapist, yoga teacher, and I've been treating people who are active and fit recover from pain and injuries for well over 20 years. And our physical therapy clinic here in Greensboro, North Carolina specializes in helping people do that without pain meds, injections, and surgery. And some of the most common but not normal problems that we've seen over the years, there's women and men, but mostly women, who are suffering from pelvic floor issues when basically they've been told, well, you're a mom and that's just the way it is, or this is the badge of honor for women. And men have these issues as well, and they report them a whole lot less. No matter who you are, if you're struggling with a pelvic floor problem, it's going to cause a lot of different symptoms like leaking and pressure. It can keep you from being able to balance and perform to your peak. It could keep you from hitting a PR when you run. It could keep you from picking up your kids. And the symptom might not be a pelvic floor symptom. It could be a back pain or a hip issue or a knee problem. That's generally what we see most people for over the last 20 years. As they come in, Dr. LeBauer, my back hurts, X, Y, and Z. Well, what else is going on? And they have some of these other issues, and they never knew that physical therapy could actually help them. So here they are, the top 6 signs that you're suffering from a pelvic floor or core strength problem that can be easily resolved with physical therapy. Number 1, you leak when you sneeze. Laugh, run, squat, jump, or even just feel the need to wear a pad when you go work out. I don't have to wear a pad when I work out, but I've definitely been at the bounce house and been like, oh, gotta go. Or not being able to hold to keep in the gas when you're at the bounce house with the kids. That's pelvic floor muscle. And way too often women are told there's nothing you can do. We should just giggle about it. I mean, I've seen family members doing that, and it's just like, okay, don't you know? But no, they don't know. So if you have had a baby or not, and you leak when you sneeze, laugh, run, jump, do double unders, or squat, or go to the bounce house with your kids, and you feel like you leak a little bit, or you need to wear a pad, physical therapy can help you. In general, there's 2 problems. The muscles can be tight and short, or the joints don't move. Generally in the pelvic floor, they can be tight and short or not active, or maybe you've relearned a different movement pattern. The same thing with back pain. It's just in the pelvic bowl. Number 2, you've been told you have interstitial cystitis, which is a big word. It sounds like an itis, like an inflammatory process, like an inflammation. You've been told you have interstitial cystitis and you need to take medications, and you've tried it, but your symptoms are not gone, and you don't want to just live with it. Because a lot of times the medications are treating something that's not, the itis, it's not really a problem. Kind of like bursitis in the hip. It's called an inflamed bursa, but it's not really. It's a muscular imbalance of the hip and maybe the ankle. With interstitial cystitis, there's a lot of other factors. And if it's not resolving with medication, then maybe it's a muscular imbalance, and your physical therapist and pelvic floor specialist can help you resolve the problem. Number 3, you feel fullness in your bottom, I'm going to use my air quotes here, bottom, when you run, jump, or even pick up your child, or put your 70-pound dog in the bathtub to wash them. What does it mean, bottom? Like, it means like your bottom, but what it really means is you're having a little prolapse. The funny thing is, and it was a little annoying, my wife and I were at Women's Hospital here in Greensboro, and she had the baby, and they're like, okay, put this ice pack on your bottom. Well, I was like, what does that mean? Well, it could be a vagina, anus, or anywhere in there that feels full or pressure, and it's from the internal organs kind of dropping down. Now, it can impede your running. I've worked with patients who've had this, it's called prolapse or pelvic organ prolapse. It's where they just kind of drop in, and and settle down instead of being held up where they're supposed to be by the muscles in your pelvic bowl. And it can keep you from running and exercising and playing feel very uncomfortable. Physical therapy can help with this, which is amazing to think. Like, most people think physical therapy is, go get surgery and then let's rehab you. Or I tweaked my back and let's do the back. Well, physical therapy is all about watching your whole body move and optimize your movement and your ability to be strong. And your pelvic floor is the key to being strong. If anyone is ignoring their pelvic floor, they're not going to be able to pitch 100 miles an hour for Major League Baseball. They're not going to be able to pick up all 5 of their kids and take them to school. Or you can do that, but it's not going to be comfortable. If you feel fullness when you run or squat or jump or lift something heavy, that's something that can be quickly resolved with physical therapy. A lot of people, and people I know, have been told, oh, you need surgery for prolapse. Well, maybe, but did they try physical therapy? Probably not. Even medical providers don't understand that physical therapy can help with these problems. Number 4, sex with your partner is no longer enjoyable or even painful, especially after having birth. Or maybe you've had other traumas in the past and it's uncomfortable. A lot of that can be due to muscular tightness. Just like when you get nervous or anxious, you might feel it in your neck. Pelvic floor muscles can do the same thing. And with retraining and physical therapy and mindfulness and awareness and specific exercises, you can reduce the discomfort and pain associated with sex based on certain problems that maybe you have in your body. Maybe you've had knee pain or back pain for a long time, or ever since having kids, it's been uncomfortable. Physical therapy can help with this. Physical therapy can help with it? Yes, absolutely. It absolutely can. And I know this firsthand, and I know that hundreds and dozens of people who've benefited from physical therapy. And I work with so many amazing pelvic floor therapists who help their patients do this, and they tell me, well, Aaron, sharing with patients, like, my patients have always said, well, I never knew physical therapy could help with this. Right. So that's why I'm here. I'm telling you that if you have pain with sex and it hasn't changed with other things you've tried, maybe you need to see a physical therapist who specializes in pelvic floor dysfunction. Number 5, you've been told that now that you've had babies, you just need to accept that you'll have leakage, back pain, hip pain, or that you shouldn't even feel confident in your body. Okay, this is the problem with our medical system. There's a bigger concern with leaving the hospital when you have babies, can you buckle your baby in the car seat, then do you know what to do to recover fully from giving birth so that you can care for your child and your body? And your body should be strong. Here's how to do it. I work with a dozen pelvic floor therapists whose mission is to make physical therapy and pelvic floor awareness and education a systemized, a default part of getting out of the hospital and having a baby. It's absolutely vital and important. All too often, you've probably been told that you just need to accept this. This is just being a mom. And like I said, I'm not a mom. I don't know that firsthand from me as a person, but I know that from working with hundreds of patients, family members, wife, friends, what we have been told. Okay, it's common, but not normal. It shouldn't be like that, and it can change quickly. So you do not need, just because you've had a baby, you shouldn't expect to leak, have back pain, have hip pain, have pain with sex, or not feel confident in your body. Absolutely. Those things are things that can change. But if a medical provider has told you that, I will apologize to you on their behalf. They just didn't know any better. I think number 6. You've been doing Kegels because you heard about them back in the 80s and it was the new thing, but your pelvic pain or pelvic floor issue hasn't gone away. Okay, so we all know about Kegels. It's when you squeeze the muscles that you use to keep from going to the bathroom, and maybe you lift them up a little higher and higher and you go to the 3rd or 4th floor. But if that's not solving the problem, what it means is you're just trying to fix something with a general exercise that's not specific enough to the problem that you have. If Kegels aren't the problem, it means tightening the sphincter muscles, or a non-tight or weak sphincter muscle is not the cause of the problem. Maybe there's something else. Maybe they need to be relaxed. Almost the majority of cases, especially ones that don't respond to Kegels, the body needs to relax and soften so that it can feel more comfortable and less threat. But specifically, which problem or which cause is the one that's contributing to what's going on with you? We don't know. I don't know. I can make a bunch of guesses, and you could Google it. You could go to YouTube. Maybe that's how you found this video. What I want to impress upon you is that you can try a bunch of different things and see if it works. And maybe it will. And most likely, what you probably need is to be able to sit down with a physical therapist or physiotherapist who specializes in treating these problems, have a chat with them so they can work as a detective to figure out exactly where did the problem start, what's the root cause of the problem, and how do we address it. Not just addressing the symptoms. So a lot of these things we talked about most of these are symptoms. And if you have any one of these symptoms, we can help you. If you have 2 or more, we can definitely help you. If you have all of them, well, we can absolutely help. Here's what I want you to do. If you've tried something on the internet or if someone's given you and it's helped, great. That means if an exercise or a self-like massage or release technique has helped, it means that physical therapy can help. If it's made it worse, if sitting on something, stretching somewhere has just made it worse, it means we need to find out exactly where the problem is, because what you're probably stretching or pushing on or pressing on is just more of a symptom, not a cause. And if there's no change, we still need to take a look at your whole body. In our clinic at LeBauer Physical Therapy, we do a total body diagnostic exam. So we look at your body head to toe. Whether you've got a pelvic floor problem, a pinky toe problem, or a headache issue, we're going to look at everything, because the way your body moves and the way you move in space, if something's going on in your right shoulder, you could feel it in your low back. And especially if you're lifting overhead a whole bunch, you'll feel it in your back. Maybe something's going on in your big toe. You stubbed your big toe years ago and it doesn't bend like it should. You might feel it in your knee, your ankle, or maybe your shoulder, depending on the activities you do. So a total body diagnostic exam is the assessment that we use that will tell you exactly where the problem is. So it allows us to know where the problem is and what it is, exactly where the root cause of the problem is, and what you can do to fix it. So if you've experienced any of the symptoms or problems that we've been discussing today, you may be a great fit for a total body diagnostic exam at our clinic, where we're going to look through your whole body and tell you exactly what's wrong and how we can help. And sometimes we can help within 4 to 6 weeks. Sometimes we can make a quick change, but there is no miracle cure. These things take time. It takes time, work, and effort. But I guarantee you put in the work and effort, then you're going to get the payoff. And what's the payoff? Feeling strong and confident and like a good role model to your kids again. I mean, strong and fit and active so you can go and run without worrying about wearing a pad. I've heard it all over the last 20-something years. So we would love to help you, whether that's with an email, a phone call, or a visit in our clinic to see what we can do to help you feel strong, active, fit, and healthy again without any more pain meds, injections, or surgery. If you'd like to get on the phone and talk about what's going on or schedule a total body diagnostic exam in our clinic, just call our clinic. It's 336-271-6677. But what I'd really love for you to do is, before you even talk to us, is download our pelvic PT checklist. So our pelvic PT checklist can be found at pelvicptchecklist.com. There's a link below this video. And what you'll be able to do is you'll be able to download the guide, and it's got a little checklist of all 6 major signs that you have a pelvic floor or core strength problem that can be easily fixed with physical therapy. So go there now, pelvicptchecklist.com, or you can click the link below, download the free guide, take a look through it, check off the ones that you have, and then at the end, if you'd like to get on a call, it'll have more information about how we can help. And if you feel like this has been helpful for you, I would really appreciate you leaving a comment below, maybe tagging a friend or sharing this video with one of your friends or colleagues or family members who needs to see this. My name is Dr. Aaron LeBauer with LeBauer Physical Therapy. Hit the like, subscribe, and the notification bell, and leave a comment below if this has been helpful for you. And we'll see you on the next video. Thank you so much.